Good afternoon, everyone. This is Farrell Thomas from Tennessee Hospital Association, and we will get started in just a few moments. Thank you so much for joining us today. All right, everyone. Thank you so much for joining us today. I am just going to give it just a couple minutes after the top of the hour before we get started on our exciting topic today to continue our conversation around apprenticeship in healthcare and funding that's available through our American Job Centers and Workforce Centers. So please stay tuned. We will get started in just a few moments. All right, everyone, good afternoon, and thank you for joining us today. We are happy to welcome you to our sixth and final webinar for 2024. We will be discussing today apprenticeship in healthcare and kind of a part two to several other lectures and webinars that we've had regarding apprenticeship, but also we'll be discussing some additional funding opportunities and resources that you have available in training and development of staff in healthcare and in your industry. So thank you again for joining us today. I am Farrell Thomas, and I just wanted to go over a few housekeeping items as we get started. Again, my name is Farrell Thomas. I am the Director of Workforce Strategies for Tennessee Hospital Association. I'm pretty sure I know many of you, but if I don't, I look forward to meeting you and hopefully being of resource in the future. Also joining us today will be Andrew Burnett. He is our VP of Workforce and Rural Health at Tennessee Hospital Association, and we will be moderating the session today. So just a few housekeeping items. All of our participants, all of you are muted upon entry. You are not able to unmute yourself. The way that you can be unmuted during our Q&A session is to raise your hand. So hopefully you can familiarize yourself with that process. We will be using the comment and question box for questions and feedback to our moderators. Those two items can be utilized by participants. And so once our presentations are completed today, we will take time to moderate, meaning provide our questions to our presenters today. Anything that strikes a nerve with you and you need to ask. And so this is the purpose of these workforce webinars, is for you to have connection with experts in this regard and in this field. All of these questions, again, will be answered in a forum style at the end of our presentations, and that way we can be sure that we get through the content. And oftentimes we find that our presenters are going to address some of your questions as well. Again, during the Q&A, you can raise your hand and I can take you off mute if you'd like to verbalize or have dialogue with our presenters. And then you can also submit that question for me and or Andrew to help answer. Our presentation materials, as well as some additional handouts that are referenced during the presentation, a recording of this presentation will all be sent to registered participants, and then we will send out a larger notification to our website, our workforce webinar website. The QR code on your screen now can take you to that website, and that website houses all of our materials and recordings for every webinar that we've had this year on this topic as well as other topics. And so we really hope that that's a resource for you all. And if you have any questions, please don't hesitate to reach out to us. Our contact information for our presenters will also be provided at the end of the presentation, as well as in those handouts, so you can reach out to them as a resource as well. So without further ado, I will go ahead and get started. Our first presenter is Joy Jamerson, and she joins us from HCAP, which is the Healthcare Career Advancement Program. And she is a really great expert on healthcare apprenticeship programs and one of our partners in facilitating this work with you all. And then she will be partnered by Marla Rye, who is the Director of American Job Center in the Upper Cumberland area and Clarksville area. So thank you so much for joining us, and I'll let them go ahead and get started.
Thank you, Farrell, for the introduction. As Farrell said, my name is Joy Jamerson. I am one of the program managers on a team of 4 here at HCAP that does all of our registered apprenticeship work in healthcare. And next slide, please, Farrell. As you may or may not know, HCAP, here at HCAP, we're a National Labor Management Organization. And then we are also a partner with the Department of Labor as an industry intermediary. So in 2015, we were awarded one of the first DOL intermediary contracts to build and expand registered apprenticeships in healthcare. And as many as you may know, healthcare was non-existent in 2015, registered apprenticeships that was. So from 2015 to 2020, we met all of our deliverables, and the DOL loved us so much that when they announced the new grant and reapplied, we were re-awarded again. So we're on our second contract with the Department of Labor to help build and expand registered apprenticeships in healthcare. And I would have to say, since 2020, well, everyone knows what happened in 2020, but since 2020, going into like where we are now, registered apprenticeships has taken off in healthcare, with the newly registered nurse apprenticeship track being approved by the U.S. Department of Labor. And now we're assisting states, including the state of Tennessee, to present the registered nurse occupation to the State Board of Nursing for approval as a track to obtain license. Next slide. So here at HCAP, we do a lot underneath our contract. And the first thing that we do is we provide free, that is right, free technical assistance to any facility, educational provider, or any community organization that wants to build or expand or even learn about healthcare registered apprenticeships. We also help partner you with different other entities, with Marla and Workforce Development, with other nonprofits that may have funding, or with other intermediaries. If you're not in the healthcare industry, there are other intermediaries like HCAP that will be able to help you build your apprenticeships. We also help customize the on-the-job learning competencies. I like to say it's the job description on steroids. So we take that and input that information into the paperwork that the state will need for approval. We work across the U.S., and I would say every apprenticeship that we've built is built differently, even if it's the same occupation. We also help with recruitment events, hiring events, and retention strategies to help you maintain and sustain employees that you currently have, and help maintain and sustain your registered apprenticeship program. And lastly, we also don't have a lot of money, but we have some funding that we'll be able to award you to help you start or help you continue on with your registered apprenticeship program. We're not a Department of Labor that can award millions, but we can award a few thousand. That's right, I said a few thousand, not hundreds of thousands, but a few thousand that can help pay for tuition, books, supplies, wraparound services. The only thing that the funding cannot be used for is for the apprentice wages. So the funding can be utilized to help the apprentice or even the mentor matriculate throughout the apprenticeship program. Next slide. So, registered apprenticeship, is it a proven solution? Is it the answer to all of our prayers and needs to help us build the healthcare workforce? And I will be the first to tell you yes. 5 years ago, before I came here to HCAP, I've been here at HCAP for 2.5 years, but I was with another entity that created on-the-job training, the online training curriculum. And at first, everything was about industry-based credentials. We need individuals to get industry-based credentials so they can get into their career fields. And it worked, but the individual still wasn't landing the job because they didn't have the experience, the work experience to go with the credential. So registered apprenticeship said it's been around for many, many years. Registered apprenticeship started to peek out of the darkness and into the light. And here at HCAP, we have led the way to building and expanding healthcare apprenticeships in all occupations that falls underneath the healthcare spectrum, from clinical and non-clinical occupations. Next slide. So we all know that we are facing workforce shortages. I'm reading content every day. I'm sitting on webinars. I'm presenting on webinars. I'm presenting at conferences. The main thing that I'm hearing is we have a shortage of registered nurses. We have a shortage of surgical techs, sterile processing, medical assistants, CNAs, and the list goes on and on. And there is no solution. Well, people think there is no solution to helping them fill those gaps. But registered apprenticeship is that solution that can help. Now, does it fit in every organization? I'll be honest and say, no, it doesn't. But if you get the information, get someone to help you understand the information, and get everything that entitles to build that registered apprenticeship, I know for sure, 100% sure, that the registered apprenticeship program will help you fill those workforce shortages at your organizations. Next slide. So what is a registered apprenticeship program? It is a training program that helps with recruitment and retention, and you're taking the didactic training from a 2-year, 4-year online provider or a technical school and pairing it with the on-the-job training. So we're not trying to change the curriculum from the 2-year, 4-year institutions or even the technical schools. We're not trying to tell the Board of Nursing, hey, we're wanting to change this or change that. No, we're asking the 2-year, 4-year, and the Board of Nursing to say, hey, we need your curriculum to tie into your clinicals with more on-the-job training experience. I don't know about you, but when I graduated from college, I did not have not one lick of experience trying to utilize my business administration degree. And when I got my very first job, I didn't even get trained. They just threw me in. And as a recruiter for the university I went to, I went to the university, so I knew about the university. So I trained myself on how to speak and talk to high school students and middle school students about going to that university. It is different when you come into the healthcare system. They can't train themselves. So in the registered apprenticeship program, the employer needs to have a mentor to help that apprentice matriculate throughout the program. And we'll talk more when we get to the components of a registered apprenticeship program. So again, we're taking didactic training at the 2-year, 4-year technical schools with no changes at all, pairing it with on-the-job training, and that's what makes the registered apprenticeship program. Next slide. So why do employers invest in registered apprenticeships? I've been doing this for 2.5 years, and this is some of the reasons why they do. The lack of training in programs. Some healthcare apprentices will go to the organization and they'll be highly trained educational wise, but don't have the on-the-job training. And that's what the employer is there for, to provide them with that on-the-job training. The lack of trained workers, high turnover, because I'm working here, but hey, Hospital B is going to pay me a quarter or 15 cents more. So I'll go over there to Hospital B for that little amount. And then the degree programs don't always prepare workers for the on-the-job realities. And I'll use the registered nurse for an example. We're helping the state of Arizona build a registered nurse program, and their hospital systems are saying that the school are doing a great job with the didactic training and the clinicals, but when they get to the on-the-job training and reality hits, a lot of the nurses freeze. So we don't want them to freeze when they're on the job. So this apprenticeship program will be able to better prepare them in their careers to help them be successful in their careers. Next slide. So the benefits for the employers, it reduces turnover. You can recruit and develop a more diverse and highly skilled workforce. It improves employee engagement and loyalty. It creates a safer workplace, reduces difficulty in finding employees for particular positions. You customize the training. You gain access to a network of employers and developing apprentices. You gain access to funding. You gain access to a more diverse population and building a more diverse pipeline of highly trained individuals. So the list goes on and on why the benefits for the employers and why employers invest in registered apprenticeships. We've had many success stories across the US, from apprentices to employers to organizations, saying that if it had not been for the registered apprenticeship program, they wouldn't have been able to fill the most important roles in their hospitals or healthcare facilities. So does the registered apprenticeship program work? Yes, it does. And this is how it works. Next slide. So when you're wanting to get engage in the apprenticeship talk or the apprenticeship journey, first we will meet to explore your options. We will, in this explore category, we're looking at all of your needs. We need industry to tell us what are your needs. I know your needs probably. I know you're going to need registered nurses, but I also do my homework. I look you up. I look on your website to see what you're hiring for. I look on Indeed to see what you're hiring for. But this is creating a safe space for us to know what you're wanting and what we can build. Not every occupation is apprenticeable in the state of Tennessee or in the DOL. So if you have a program that is not yet registered or approved by the DOL or by the state of Tennessee, there is additional paperwork we will have to do. So we'll be doing all of that exploring in that category. From exploring, we will start building out your program. I like to use a house. So in order to build a house, you need a strong foundation. And the employer and the educational provider in a registered apprenticeship, that's our strong foundation to building a successful registered apprenticeship program. So we will make sure that we're partnering with the educational institutions, the correct or the ones that you want to. We will make sure that we bring in other entities to help build the registered apprenticeship program and help you understand the apprenticeship program. Then we will partnerships look like here at HCAP with your workforce development, your American Job Centers, THA, of course, and then any other entities or nonprofit or community-based agencies that will help you sustain your program. Next slide. From partnering, then we have to register the program. In order to be awarded funding on a state level or even apply for funding on a state level or federal level for registered apprenticeships, you have to register your program. So to register your program is no cost at all. It's just paperwork. And here at HCAP, we help you complete all of the paperwork. We know you all are busy. So we'll take that paperwork and complete all of the documentation, letting you know what we're doing. We'll meet monthly or we meet weekly before you submit. Once we submit all of the paperwork to the state of Tennessee for approval and they receive approval, you would then be able to launch your program. We can have a big parade because from start to finish of building a registered apprenticeship program, I like to give it 3 to 6 months to make sure every T is crossed, every I is dotted, and every partner is on the right page. So ensuring that once we launch the program, it is going to be successful. Next slide. So there are components to this registered apprenticeship program, and this is what we present, or we like to present to different nursing boards or licensing boards or regulatory boards to help them understand how a registered apprenticeship works. So you can go to the next slide. At first, it is industry led, and a lot of our educational partners get hung up on this one piece. They ask, why is it industry led? And we always tell them it's industry led because this organization or this industry is going to be the ones hiring your apprentices. The apprentices, yes, they're going to complete your curriculum, they're going to complete the clinicals, but when they get to the industry, when they get to the employer, there is more things that they will learn outside of your curriculum and outside of clinicals or interns or externships. So it's industry led because we're asking industry, one, what do they need? And two, what do you want this apprentice to learn while they're in this apprenticeship program? So yes, the school have all the right to complete all of the clinicals, the nurses, the surgical techs, whatever they have to complete school-wise, didactic training-wise, they will complete. But when they get to on the job, when they get to the on the job training, it is industry led and they're going to be taking them much further than where they started. Next slide. And again, it is a paid job. I like to say a paid career. So apprentices are supposed to be paid from day one once they start the program. Employers can decide if they're going to pay them while they're doing the didactic training, or they can decide if they're only going to pay them once they start the on-the-job training. What we're trying to do and what I suggest is telling the employers to pay them while they're doing didactic training. And you can say, well, Joy, why would we pay them while they're doing didactic training? They don't have the right license or certification. You can hire them in a role that doesn't need a license or certifications to get them acclimated to your organization. And once they get the license or the certification that goes with that occupation, that's when you can give them their wage increase that's needed, and they start doing the on-the-job training for that occupation. But these are real jobs with real dollar amount paid salary, either salary or paid hourly positions. So if you're an employer on the phone, this is what gets employers hung up on. Why do we have to pay them? This is not free labor. This is not an internship or an externship. This is actually a job. They're starting their career with your organization. And do not fret, employers, because in the state of Tennessee, they do offer a tax credit in the amount of either $2,000 or 10% of the wages of the apprentice. So there is help for you to help supplement the apprentice wages. And then also for tuition support, they can offer up to $11,600 for 2 years at a school, at the schools, institutions, or entities governed by the Tennessee Board of Regents and the University of Tennessee Board of Trustees. So there is funding, and Marla is going to talk more about that, how you can help pay for the apprentices' wages. But that's one area where I know for the tax credits, you'll be eligible to receive those tax credits for every new apprentice you hire. Next slide. For my educational providers, we need your curriculum again. So the curriculum that's needed, the hours for the apprenticeship program, we need 144 hours. If we're utilizing a 2-year institution or a 4-year institution, we know you succeed this 144 hours. So we would take your credit hour curriculum and just convert those credit hours into contact hours. So the state of Tennessee state director or apprenticeship training representative can see that we are meeting the 144 hours that's needed for the educational component. And that is different from the number of hours that's needed for the on-the-job training, which is the next slide. So for the on-the-job training, it is structured. So a lot of people think, oh, once they get to the apprenticeship program, they can just do whatever they want. The apprentices doesn't have a mentor. They're just going to and they're just doing anything. That is not true. That is false. So the on-the-job training is structured. It's structured by the employer. So the employer will tell us what they want the apprentice to learn while they're doing the on-the-job training. This is why we rely very heavily on the employer to tell us what's needed and what they need the apprentice to learn while they're doing their 2,000 hours. Also, the employer needs to provide a mentor to the apprentice. So I'll use the registered nurse. I know in clinicals they do different rotations, and the question is always asked, can they have different mentors? And the answer is yes. So if they're in pediatrics for 6 months, then they can have a mentor, 2 or 3 different mentors while they're in pediatrics. If they go to OBGYN for 2 months, they can have 1 mentor, 2 mentors in OBGYN. The only thing we ask for you when you're choosing your mentors is making sure that your mentors are trained, highly trained in the field of study, or you provide them training on how to be a mentor to the apprentice. I should say not or, and provide them training to be a mentor to the apprentice. And here at HCAP, we do offer free mentor training to all mentees and to all of our partners who partner with us. Next slide. So the apprenticeship also comes with credentials. This slide, when I'm talking to healthcare providers, it's nice that the apprentices will get a certified U.S. Department of Labor certificate of completion from completing the registered apprenticeship program. But guess what? They still have to sit for their license, certification, or whatever they need to actually practice in that occupation. So that credential from the U.S. Department of Labor does not take over the license or the certification. So we have to clear that up too. They still have to sit for the certification or the license that's pertaining to that particular occupation. Next slide. Registered apprenticeships also promotes diversity in underrepresented communities. So this is another way to help uplift and upskill your current incumbent workers or even external workers. Some people can't quit a current job that they have to go to school to get a higher degree or get a degree or the certification needed to do the job. And the registered apprenticeship is really taking that barrier away. They're actually going to school and doing the job that they're wanting, and they're getting paid while doing it. Next slide. And last but not least, a registered apprenticeship program promotes quality and safety. As I said before, when I first started out, my employer just told me just do what you need to do to recruit students into the university. I didn't know nothing about recruiting. I knew about the school, but I didn't know anything about recruitment. But with quality and safety in the registered apprenticeship program, that mentor will be with that apprentice throughout the entirety of the program while they're at your facility, making sure and ensuring that that apprentice is being competent in all of the duties and assignments that they need to do. Next slide. So if you are ready to initiate your healthcare apprenticeship program, I know I went through that in a hurry, but it's a lot of information. It's a lot more information that we can talk about one-on-one. You can ask me any types of questions. How does this work in this occupation? How does it work in that occupation? If this occupation is approved by the DOL or by the state to build, we have answers for you. So next slide. So how can HCAP help you? One, again, we can help provide incentive funding to help pay for mentor training, to help pay for the tuition or fees for the apprentice, to help buy supplies for the apprentice. Anything that you would need for that apprentice, that funding will be able to help. We also help with partnership building. We help customize the program so it can be your program, your organization with your stamp of approval. We provide free technical assistance so you will get one-on-one time with Joy. I love it. And I would bring a whole team with me if I need help with helping you talk to licensing boards or regulatory boards to getting those programs approved. We help with recruitment and retention. And then also, like I'm doing here at Tennessee Hospital Association, we help host events. So if you're wanting to do a career fair, if you're wanting me to come and talk to your apprentices, anything that you're wanting us to help you do to help launch your program, to help build your program, we're here to help you do just that and help you be successful in your registered apprenticeship program. Next slide. So I said there's a sponsor. There are 3 different roles in a registered apprenticeship program. You have the sponsor, who's the holder of who's the administrator. That's the organization that will submit the paperwork to the state to be approved. Then you have the employer, and then you have the related technical instruction provider. Can the employer be the sponsor? Yes. Can a related technical instruction provider be the sponsor? Yes. Can the employer be all 3? Yes. Can the related technical instruction provider be all 3? Yes. But if you don't have the bandwidth to be the sponsor and you're wanting to do a registered apprenticeship program, we can help you. So here at HCAP, we have what's called the National Center for Healthcare Apprenticeship Programs. We're actually a registered sponsor through the U.S. Department of Labor. We have about 30 programs approved from CNA all the way to registered nurse residency, surgical tech, sterile processing, community health worker, and the list goes on and on. What does that mean? That means we will be the sponsor, you can be the employer, and we'll help you find a related technical instruction to provide the didactic training. So you don't have to do any of the paperwork in the state of Tennessee. What we will do is just have you complete the necessary paperwork for us to register your apprentices in the federal system, so you can say that you are doing a registered apprenticeship program. So if you're wanting more information on that, my contact information will be at the end of this presentation. And then one more thing before I get off and Moreland take over. It is not scary to do a registered apprenticeship program. We'll have subject matter experts at your fingertips to help you understand it, help you build it. So I encourage you all, if you have more questions or need any assistance, please do not hesitate to reach out. I'm always here to help you. And I'll pass it on to Marla.
Thank you very much, Joy. And folks, I just want to say, I know everything that Joy just went over. It sounds like it's complicated, but Joy is there to do the work for you and to help you navigate this system. My name is Marla Ryan. I'm the Executive Director of the Northern Middle Tennessee Workforce Board, and I have been in workforce development now for 34 years, and I respect the positions that you are in as hospital administrators, human resources professionals, and I know the challenges that you face every day trying to find qualified workers. One of the things that we do is we are here to help you through administering state and federal grants that support workforce development. There is an American Job Center and a workforce board all across the 95 counties in the state of Tennessee. There are 9 workforce areas. I administer the Northern Middle Workforce Area, which is 13 counties that are contiguous to Davidson County and along the western border there. So I am my peers are across the state, and I've got their contact information for you at the end, and we'll go through. But we have a simple function, and that is to help both job seekers and employers come together. Job seekers, we help remove barriers. Employers, we're helping you make the connection with job seekers. And if we do our job, you're coming together for a productive employment relationship. Next slide, please. So I'm going to talk just briefly about what we do to assist job seekers and individuals. And through the American Job Center, we're operating programs that are funded under the Federal Workforce Innovation and Opportunity Act program. And I tell individuals and I tell employers, you need to take advantage of these programs because their taxpayer dollars are funding them. So you are funding these programs and they need to be put to work for you. So for job seekers, we help individuals that are primarily from targeted populations. They may be youth, they may be dislocated workers. A dislocated worker is someone who's lost their job through no fault of their own. We've been working with plant closings in Dixon County and Davidson County, and we take those individuals that are losing their job and help retool them so that they can get back into the workforce quickly. We also help adults that are unemployed or underemployed. Maybe it's someone that's working at McDonald's that's aspiring to do more. We can help scholarship them. We work with justice-involved individuals, offenders, welfare moms, anyone that has a barrier to employment. We're here to help them overcome those barriers and get back into the workplace. So how do we do that? We have scholarships available for them where we can send them to training. We can provide them a scholarship to participate in an apprenticeship program. We can help with childcare, transportation, uniforms, tools, anything that they may need to overcome their barriers and become a productive employee. And we provide them with support services and counseling to not just get them into school, but make sure that they stay in school. So a lot of these individuals are going to be eligible for work opportunity tax credits. If you hire them, then they will, you'll be rewarded through year-end tax rebates as well as other opportunities. So that's what we do with individuals. Let's turn our attention to employers. Next slide, please. So what can we do to help you as an employer? We have grants that are in place that can help with on-the-job training, incumbent worker training, and apprenticeship training. And we're going to go through each of those individually. But also just helping you recruit workers. If you haven't gotten your jobs posted through the American Job Center, I encourage each of you to reach out to your American Job Center and post those jobs, do interviews there, participate in job fairs. Those are all things that are available to you free of charge. So let's talk a little bit about funding opportunities. Next slide, please. So one of the things that we can do to help you is through on-the-job training contracts. So let's just take Marla for an example. And Marla may be a single mom that is on welfare assistance, and maybe I'm going to school to be a CNA. If I'm participating in this program, if you take a chance and hire me, then through our programs, we can execute an on-the-job training contract with you where my program will pay 50% of the wages for 6 to 10 weeks, up to about 400 hours, and cut your training cost in half after I've gone through and received my certification. So again, that's a way for you to minimize your payroll expenses, reach out, give an opportunity to someone that may not have all the experience that you're looking for at the beginning, and receive this reimbursement directly to you in the form of 50% of their wages. If that individual, again, is qualified for the program while they're participating in this training program, we could can help with transportation, childcare assistance, so that as they're a new employee and they're maybe struggling to adapt to your schedule, we're there providing them assistance along the way as well. Next slide, please. So, incumbent worker training grants. One of the real challenges that I see today in the workforce is that you may have individuals that are currently on your workforce. Maybe if you're in a hospital setting, maybe they're in housekeeping, maybe they're in the cafeteria, maybe they're just in an administrative role, but they have been with you for 5 years. They come to work every day on time. You know they're good. They just don't have the skills they need to advance in the positions that you need them to. As a for-profit hospital or a nonprofit hospital or healthcare provider, you can apply for an incumbent worker training grant to help you upskill, to take maybe 5 or 6 individuals that are in housekeeping and send them to an LPN training program or put them in an apprenticeship training program, and we can offset that cost by up to $25,000 per federal employer identification number. So if you are an organization that's got several facilities and each of those have got a federal employer identification number, you can apply for a grant for each specific entity. And we've worked with NHC Healthcare and awarded multiple contracts with several healthcare organizations. But we don't tell you what training that you need. We don't tell you what employees that you need to upskill. That's something that I would recommend as a best practice to improve your company culture and retention rates, is having a career pathway that individuals can go into, and you can help offset their cost. Now, Farrell is going to send out at the end an attachment that has got the guidelines for the federal incumbent worker training program, and also the 6-page application. And again, it is a very easy application. It's a fillable form, and we can help you work through that application. Let's just say you've worked with Joy and you've got an apprenticeship program ready to go. You could apply for that $25,000 to help offset some of those RTIs or those mentors that you have. We could reimburse their wages as well. So that's just an opportunity that is available for you as a for-profit or a nonprofit healthcare. Couple of requirements: you have to be in business for at least 1 year, and you have to have at least 5 full-time employees, and your incumbent workers need to be on your payroll for at least 6 months. You know that you're ready to invest in them and upgrade their skill sets. Next slide, please. So one of the things that Joy mentioned was getting approval from the state of Tennessee. The state of Tennessee has just become a state-administered apprenticeship training program, and the Department of Labor has what's called Apprenticeship Tennessee. And I asked them for some information earlier this week, and they have got right now 31 sponsors in healthcare occupations in Tennessee. They've got over 110 employers that are participating, and 26 healthcare occupations to include phlebotomy, LPN, medical assistant, CNA, medical recording, different occupations that are already established within the state of Tennessee. So if you work through Joy, she's going to get you approved through the state of Tennessee, and that's going to qualify you for another grant. Next slide, please. That is the apprenticeship training grants that is made available through Governor Lee, and the state legislature has allocated funding for Tennessee employers to create more apprenticeship opportunities. So you can qualify for a $2,500 payment or a grant for a first or a second year apprenticeship program, or if you've got a longer apprenticeship program, we will pay $1,500 for a third and a fourth year apprenticeship program. Again, with your materials, I've got a guideline for you for applying for the grant, and I'm happy to say this application is only 3 pages, so very easy, and for you to be able to take advantage of the funding programs. It does have to be an approved apprenticeship program. It can't be just an internship. It has to go through Joy or the Department of Apprenticeship Tennessee for approval, which can be helped. This cost can actually help you with the related technical instruction. So if you're working with a TCAT, or if you're working with a community college or a 4-year program, it can help offset that training cost. or it can actually help offset the wages of that apprenticeship. So very, very advantageous for you to help offset the cost. Also in the state of Tennessee, our TCATs have apprenticeship funding as well, and that we can help you leverage all of this. I know TCAT Nashville is working with, I believe it's Ascension Health, with an apprenticeship program there where they've got funding through a very large grant there. Also, the Department of Labor in the next couple of weeks will be coming out with additional apprenticeship opportunities and funding for rural healthcare providers. I haven't been told for sure, but I think they will be maintained at the $2,500 and the $1,500 wage limit as well there. You do have to be a for-profit or a nonprofit healthcare provider. You've got to be current on all of your state taxes, and that will be one of the things that we look at in the application. So next slide, please. As you look through, and as Farrell sends out this apprenticeship program, you can look at the map of the state of Tennessee and see which workforce area that you're in. And these are the contact information for those areas that have access to the same types of funding that I have gone over today. Next slide. So this is my contact information directly, and if you've got any information, any questions that you are unsure about, want to reach out, please feel free to call, email me. And I know Farrell wanted to leave a few minutes for questions and answers, so I think we've got a few. So Farrell, I'll turn it back over to you and see what you might have in the question comment box.
Thank you so much. Thank you, Joy and Marla. Again, this is Marla's information, and we will share that with you all. I'll go ahead also and share Joy's information. They have these handy dandy QR codes, which is really great. And Marla's QR code also takes you to her overall American Job Center site, and lots of great information there that she shared with us this afternoon. So I want to be sure that I get to our participants, because we've had a great participation today. Does anyone have any questions for Marla or Joy? I have a few, but I want to make sure you guys get a chance. If you do and want to come off of mute, please raise your hand. And otherwise, you can also put your question in the chat box. Oh, I got one. John, I'm going to unmute you here.
There we go. I think you can hear me now, can't you, Farrell?
There you go. Yep. Yes,
Lovely.
sir.
Lovely. Appreciate it. Nashville State over here, John Cunningham with Nashville State Workforce, and I have Donna Whitehouse, the Dean of the School of Health Sciences. We were just going to ask you, Joy, could you further define those 144 pre-apprenticeship didactic hours? Because we're just thinking about what that looks like for us, and just expanding on that a bit. Thank you.
That's now I was talking and wasn't hearing me. So if you look at your current curriculum right now, if you share it with me, I'll be able to see if you're on a credit hour or you guys actually do contact hours. So those hours can be anything that's approved by the Tennessee Board of Regents or the Board of Trustees that your students take. So if they're currently in a CNA program, you probably have them you probably have the CNA training program at your school, or you're utilizing the 2-year program. that curriculum will be able to use in your registered apprenticeship program. A lot of other employers or schools also add to the curriculum. Well, not add, they'll add additional hours to the curriculum. So they will go over 144 hours, and they'll teach them professional development or soft skills, or even some of those hard skills that they would need to be successful on the job. So the 144 hours is the actual curriculum for the occupation. So if they're in, I'll use registered nurse, if they have 4 years of college education with their School of Nursing credits, then that is going to automatically allow the student to be in a registered apprenticeship program, and a curriculum will be able to be utilized. If you're going to do like have your CNA students that they haven't went through a registered apprenticeship program, but you want them to get into one, they can also be offered credit for prior learning for what they've already learned for the curriculum. So I would have to look at your curriculum to ensure that it reaches the 144 hours. So it's really the curriculum that you're currently teaching your students.
Hey, Joy, this is Donna Whitehouse, Dean School of Health Sciences over here at Nashville State. Question for you about that. So we do have a 2-year ADN program, so they are involved in nursing classes. What is the difference between what our students who graduate from our program with that RN and potentially would step into apprenticeship program? So they have over 3,000 hours or 64 credit hours worth of college experience, and someone who has only has the 144 hours and then steps into the apprenticeship program. What's the difference? Is that program for both of them, or is it not for both of them?
It can be for both. So if you're taking your students and wanting to put them through a registered apprenticeship program, like I said before, you can offer them credit for prior learning. So that 144 hours, that's just the DOL's requirement. Some programs have more than 144 hours of curriculum, and we can't change that to just fit that 144 hours. So we encourage, if you have more, that's great. That's only going to make your program longer. So if the apprenticeship program is technically 1 year, so 144 hours with 2,000 hours of on-the-job training, 1 year. If you go up to 2 years, we're just adding 4,000 hours of on-the-job training and 288 hours of the RTI, the related technical instruction. So it depends on the occupation to determine how many RTI hours is needed and how many on-the-job training and how many years of schooling that individual will have to take in order to get into the apprenticeship program.
Want to clarify and make sure I'm on the right path.
Mm-hmm.
Because I'm on the educational side of things.
Mm-hmm.
So if we have a student who's in an ADN program,
Mm-hmm.
they go through the 2 years with us and they become an RN at the end of that. We could also have a student that takes targeted 144 hours of targeted education and then goes straight to the apprenticeship program, does not complete a Tennessee Board of Nursing approved educational program, but that would still qualify them to take, so that 140 hours plus the apprenticeship qualifies them to sit for the RN exam.
Mm-hmm. No, ma'am.
That's what I want to clarify.
No, ma'am. I did not say that, Miss Ma'am.
That's exactly why I'm asking the question, because it sounds
Thank
like
you for answering that question. No.
Yes.
So with the curriculum, and I love that you put like the ADN and RN, because this is the conversations we've been having with nursing boards and other educational institutions. We need your approved curriculum. So just because we say 144 hours, that's the requirement. But your program is longer than 144 hours, which will make the apprenticeship program longer than a year. So we're taking your approved Tennessee Board of Regents curriculum and utilizing that in the apprenticeship program with the employer. So someone can't come in and just take the 144 hours and say, I want to sit. No, you have to go through an approved program for an ADN or RN program to sit for the license. So that's what a disconnect with a lot of institutions and a lot of Board of Nursings across the US is that they're thinking someone can just walk off the streets and say, okay, I took 144 hours of nursing school and I can sit. No, I come out of higher ed. So if you say you took some nursing courses, I need your transcript. I'm going to send it to the school for approval to look at making sure that they can transfer some of those credits in. Now, what they can do is award credit for prior learning if someone has already taken some courses but dropped out because of personal reasons. So the sponsor can award that person credit for prior learning if the school accepts those transferable credit hours. If they're not, they have to start from scratch.
So would I be correct or incorrect in saying, describing the apprenticeship as a bridge from the entry-level training that you get as an ADN or a BSN program to specialty practice in a particular area? Would that be correct or incorrect?
Farrell had already hand up.
Yep. Hey, Donna, it's Farrell. I'm going to jump in here. And not that, so this is where that semantic thing comes in sometimes with us. But so the apprenticeship is an supportive model. So I'm gonna tell you what I compare it to. So I compare the apprenticeship model to a DEU. So a dedicated education unit is where you have a very, direct relationship with an employer. You're training staff to be mentors and preceptors for your students for their clinical and training hours. Now, they don't get paid for those hours, and those hours are only the hours you require for school. In an apprenticeship, they're employed as well as being a student. So this is a pathway to obtain that clinical on-the-job training experience that mirrors the competencies and the requirements of your existing academic program.
Mm-hmm.
So I'm a student in your program, right? And I'm taking your classes, and now it's time for me to do Adult Health 1, and I'm probably dating myself here, but Adult Health 1 clinicals. But I decide, you say, hey, Farrell, we have this great relationship with this employer over here, and they will hire you, and you can get your hours and your and your clinical hours, your training, you get paid, you work as you're going to school in the industry that you're training for. And then you can also, if you have ability, hey, guess what, Donna, I want to pick up, or hey, employer, I want to pick up that Saturday because I need to work a little bit extra. I'm still working in that apprentice role. I'm still functioning one-to-one. So once I'm apprentice, I'm always an apprentice. But those hours mirror the needs for the academic program, and that communication between the employer and the academic training program exists so that we can make sure we have a successful, prepared student and worker for the future.
That DEU, that helped clarify. Thank you.
You're welcome.
Thank you.
All right, Max. Yeah, you're welcome. Thank you, John. Great question, and I'm sure others appreciated that insight. Max, I'm unmuting you. So Max, go ahead and ask your question.
So around the 2,000-hour work requirement, you had mentioned that if it went longer than a year, you would go to 4,000 hours. And my question is, like with nursing school is so intense. In a previous job that I had with apprentices, we only required them to work 2 12-hour shifts a week, which does not meet the 2,000-hour requirement. So how do we meet that?
So in the apprenticeship program, I didn't go in greater detail on the 2,000 hours. So in the apprenticeship program, there is 3 ways that you can build your apprenticeship program. So there's time-based, there's competency-based, and it's hybrid. In the US, in every healthcare facility that I've helped build the program with, or our subject matter experts have done, we always build competency-based apprenticeships. So we're taking, instead of saying 2,000 hours, the student is matriculating through their competency task list. In the DOL's eyes, those competency task lists will equal up to 2,000 hours, especially when you're getting into those more advanced occupations. So we don't, even though we don't put a number of hours by each task for that apprentice, we still have to say that this program is 2,000 hours. So, and then it goes up to $4,000 when you start adding additional years to the program. So if you're doing a 2-year ADN, that's going to be a 4,000 hour, 288 related technical instruction hour program. So in every program that we've built so far has only been 1 year outside of the higher wage occupations. So it's 2,000 hours, 144 hours, but we build competency-based models.
Makes sense. Thank you.
You're welcome. Thank you for that question, because a lot of employers get hung up on that 2,000 hours as well.
Joy, I think it's worth noting that Max is probably the only employer on the call that has hands-on experience, as he came from a hospital system in Alabama.
Awesome.
Yes, all right. Wonderful. Well, we are at the top of the hour. If anyone has any questions or any feedback, again, we will be sharing all of the information that our presenters have shared today. Again, this is Marla's information at the American Job Center, as well as Joy Jamerson at HCAP, and we are so grateful for their partnership and support. I just want to publicly say that both Joy and Marla are truly ambassadors for the work that they do and have been a great pleasure to work with, not only this year, but in many connections and many resources. So thank you again to both of you. Thank you to all of our attendees and for being a part of our series this year. We look forward to providing more information. If there's ever anything that we can do, please reach out to us here at THA. And have a great weekend. Stay dry, everyone. Thank you so much.